things do remain intact with aging, and some things are a bit more impaired with aging. So things like crystallized intelligence, and crystallized intelligence is things that we acquired through experience. So things we did for work, things that are our hobbies, for example. If we know another language, like that stuff will stay with us, versus, or I'll just go through the things that remain the same. So sustained attention, so if you're focusing on one thing, easy to focus on one thing. Language abilities and comprehension stays the same, and also remote memory, so things that you remember from a long time ago versus more recent memory. And then some things that can be impaired with aging is more complex problem solving, processing speed, and abstract thinking. So I have the dog there because the saying is you can't teach an old dog new tricks, but you can actually teach an older adult new things, but it just might take a little bit longer. So because of that processing speed, and it depends on their age and just the level of if there is any cognitive issues. Also, there is a decreased ability to multitask, and I know myself, as I get older, it's hard for me to multitask and to pay attention to multiple things, and I think it just gets probably worse with the older you get. Spontaneous word finding, declarative memory is learning new information. And executive functions, and that is, decision making, completing multi-step instructions, just more kind of higher level thinking things. So again, what can you do? Big one is physical activity. It increases the blood flow to your brain. It also helps with things like high blood pressure, high blood sugar, to control those things. Healthy diet, and avoiding or reducing alcohol. Staying mentally active, so things like crosswords, picking up a new hobby, learning a new instrument, just something that is new for your brain to learn is going to train your brain and help keep it young and in shape. Social interactions are very important. I'm glad you guys are all here today because I'm sure you're getting all that social interaction piece. So friends, family, neighbors, church, volunteering, things like social events and activity groups are great because you're getting social and you're also getting your physical activity. Keep your blood pressure, cholesterol, diabetes under control. And if you do smoke, it is highly advisable to quit for so many reasons. So some of your questions about cognitive and nervous system. So do Alzheimer's disease and Parkinson's disease run in families? So having a close relative, such as a parent or a sibling with Alzheimer's disease, does increase your risk, but it doesn't guarantee that you're going to get Alzheimer's. Age is actually the most significant risk factor. About 10 to 15% of people with Parkinson's do have a family history, but it's actually considered also not a very strong relationship. And Parkinson's is thought to be more like they don't really know. They think it's more of environmental things that cause Parkinson's versus a genetic link. The next question is, what happens to the brain that causes forgetfulness? Not dementia, but what was it that I came into this room to get? And I think that happens to everyone. So I think it's a combination of age-related, like loss of the neurons, and then also that like multitasking, because if you're doing a bunch of things and you're doing one thing in one room and you run into the other room to try to figure out, to try to grab something, it might have just like fallen out of your brain. So I wouldn't be super concerned about that unless, all of a sudden you're driving and you don't know where you're driving to. That would be more concerning. And things that, things that would, affect that kind of clarity with your brain. Could be the quality and the quantity of your sleep, what medications you're on. There could be nutritional deficiencies that affect how we think, thyroid issues, alcohol use, and stress. All kind of affect that part. There was a question about sleep. Do I need more sleep? Even though I get 7 to 9 hours, I seem to be more of a klutz. So again, if you feel like you've slept a long time and you wake up unrested, I would get checked for sleep apnea. Sleep apnea is a very common sleep disorder. It's where you kind of take long pauses between breaths when you're sleeping. Several things can cause it, but it's easily fixed with, well, not easily, but you have to wear a mask when you sleep. That helps you breathe, but it is, people that do go on the mask actually report much more restful sleep. And it also, as I mentioned in the cardiovascular portion, sleep apnea is not good for your heart, because if you think about it, if you're not breathing for long periods of time while you're sleeping, your heart's not getting the oxygen that it needs, and it has to work harder. So yeah, I would, if you're not feeling restful, I would get checked for that. And if you need a nap during the day, take a nap. But if you need really long naps, like more than 2 hours, I would say, every single day, and you're just feeling really fatigued, I would probably talk to someone about that. So next, we'll talk about the lungs, our pulmonary system. So there is a decrease of muscle strength in the actual diaphragm and also our intercostal muscles. Those are the muscles between our ribs that kind of help us expand our chest. There is a stiffer chest wall, and that's just unfortunately a consequence of aging. The diaphragm is the big muscle down here that helps us breathe, also gets weaker. And all of these things cause shallow breathing. And this in turn increases the risk of infection. Aspiration, which is when foreign matter goes into the lungs. And then also bronchospasm is when things are just kind of spasming, and asthma. Smoking, again, obviously doesn't help any of these things. There's also dryness in mucous membranes and a decreased cough reflex. We'll again mention that in atypical presentations, because there is a higher risk of pneumonia in older age because of all these things, because you kind of, all those things that are meant to protect you from the infection going down into your lungs are not working as well anymore. So you just have to be really vigilant for that. There's a decreased response to low blood oxygen level and elevated carbon dioxide levels, which increases the risk of respiratory failure, and just an impaired gas exchange because of the physiological changes that happen in the lungs. Yeah. So again, keep up your physical activity, because just like any muscles, the diaphragm, if you're working out physically, that diaphragm is going to have to work out as well. So it's going to keep up the strength much more than someone who doesn't work out or have physical activity. And again, if you do smoke, try to cut down or quit. And if you don't smoke, please don't start. And living in California, we do have wildfires, so during this wildfire season, try to protect yourself with a mask, get an air purifier for your home, because that is very toxic smoke from the wildfires. So the gastrointestinal system too undergoes some changes as we age. There is decreased absorption of nutrients, and especially of important vitamins such as folic acid, vitamin B12, calcium, and vitamin D, which increases the risk of osteoporosis. The nice picture there is something very, very common in folks over 50, and that's diverticulosis. That's the little outpouchings in the large intestine, which can then kind of trap food and bacteria or waste, I should say, and bacteria, and become diverticulitis, and sometimes will need to be, have surgical intervention, unfortunately. There's also increased risk of incontinence, and decreased GI tract immune response. If there is food poisoning, it might affect you much stronger than someone of a younger age. And just wanted to put it out there because I think sometimes we talk ourselves into, if we have some of these strange symptoms, we think they're normal. But I just wanted to say nausea, vomiting, abdominal pain, and constipation are not normal symptoms. And if you're constantly struggling with that, I would definitely talk to someone about that. There's also an increased risk of gallstones because there is a decrease in gallbladder function with aging, and gallbladder is the organ that helps with digestion. The liver is also more susceptible to damage by stressors. Overall, the liver function doesn't really get that much worse, especially if you take care of your liver by not drinking, smoking, and then certain medications. Beware of Tylenol. Tylenol is a great medication, but there is a limit to how much you should take in a day, and it's usually 3,000 milligrams. And if you take more than that, it can damage your liver. So I do think they put that on the little bottle, but most people don't read the little bottle. And there is a decreased medication clearance, which can lead to medication adverse events, which we deal with a lot in the hospital. And that's one of the big things we do as geriatric resource nurses is try to make everyone aware that medications affect older adults a little bit differently than younger people, and we have to be extra cautious when we're ordering many things or we're not adjusting the dosages, etc. So what can you do for your GI tract? A big one is to eat a high fiber diet. That helps with some of that risk of the diverticulitis and diverticulosis. Like fruits, veggies, whole grains, basically that kind of keeps things moving, because when you get constipated or you have hard stool, it increases the pressure inside the colon, and that causes those little outpouchings to happen. So drink plenty of fluids, and then fruits, veggies, whole grains. Limit high fat foods and meat. So if you love meat, that's fine. My husband loves meat, but you always want to kind of pair it together with something that has some fiber in it. Don't ignore the urge to have a bowel movement, because sometimes that can also cause constipation. And if you're having trouble with constipation or other GI symptoms, I definitely encourage you to talk to your healthcare provider. So some of your questions about the GI system or nutrition. The first one was, do we need to consume more protein as we age? The answer was yes. People over 65 should roughly double the protein amount recommended for adults. But again, if you have been told that you have kidney disease, you might need to limit how much protein you get each day. But basically, it roughly is about 0.72 grams per pound per day. If you Google it, there is a calculator that will tell you exactly how much protein you need to have per day based on your age.
How do you find that?
If you just Google, we can chat after. I'll show you. So what supplements have been shown to be useful and or necessary? So this is an interesting question. I remembered in grad school in my pharmacology lecture, one of the speakers said that Americans have the most expensive urine in the world. And that's because we take so many supplements here, and many supplements are water soluble. So if your body actually has enough of those supplements and you take extra, it actually just goes out with the pee. And they're very expensive, and they're not regulated by the FDA for the most part. So I would just be very cautious. I think the things that are recommended are things like calcium and vitamin D, because those help with bone health, and we kind of went over how, it's a little bit harder in older age for your body to absorb it naturally, and it's hard to get enough of it. Also vitamin B12 and folic acid help with nerve function and to prevent anemia. And then if you have a specific health concern, or a condition that might require some extra vitamins, I would discuss that with your primary care doctor or provider. Another question was, why do spices bother us as we age? So this was an interesting one. I had to do a little research on that. But apparently there's a decrease in stomach acid production, which can make digestion of spicy food tougher on our system. There's also less saliva as we age that we produce. And so spicy foods can feel more intense when we taste them. And then some medications can alter how we taste. Typically the sense of taste can go down with aging, but I think maybe spices, you become a little more sensitive. So yeah, that was an interesting one. So kidneys and the urinary tract, kidneys actually, it's a big one because it filters a lot of the toxins out. So we just have to take really good care of our kidneys. And because there is some normal aging things that does happen with the kidneys. So there is a decrease in the kidney mass and the blood flow to the kidney, and also the filtration rate. And the blood flow is important because I mentioned already keeping your blood pressure and your blood sugar under control, and also your cholesterol, because the kidneys have all these little vessels in them, and if those vessels are not taken care of, then the kidney is not going to do so well. And it's the same for your eyes and for your brain. Like anywhere where we find these little vessels, we just have to take really good care of those conditions that affect the blood vessels, to take care of those organs. And this is the other reason why we're so cautious with medications in older adults, because lots of medications get excreted through the kidneys. So a lot of times we have to get, your liver or your kidney function test and then adjust things based on that. There's also a decrease in bladder elasticity, muscle tone, and capacity. So there is a bit more incontinence that happens with older age, and also post-void residual, which is like the urine that's still left in the bladder after you've peed or urinated, and also urine that happens at night, and increased risk of urinary tract infection because of the urine that kind of like hangs out in the bladder, and then increase of risk of falls because of the nighttime urination. So some things you can do to keep your kidneys healthy is hydrating, like I said, managing your blood pressure, diabetes, and I missed also to put cholesterol. My office mate is actually the kidney clinical nurse specialist, and I hear her all the time talking to people about eating more plant-based because that helps control your cholesterol. She actually counsels people who have to go on dialysis, and sometimes when they go completely plant-based, they can get kind of push the dialysis off for several months, which is really big because dialysis is no fun. So eating a healthy diet, prioritizing plant-based. If you do have known renal disease, again, exercise is important. You want to be cautious with supplements and herbal remedies. I actually asked my office mate about if there's any specific supplements or herbal remedies that are bad for the kidneys, but she couldn't name any. But it's more about, I think, over-the-counter medications, especially what we call non-steroidal anti-inflammatories, such as Advil, Aleve, also known as ibuprofen or naproxen. Just be cautious with those because they do affect your kidneys. So you just, want to not pop them like candy. I do sometimes, but yeah, I always think of my kidneys when I do. And you definitely want to get like your regular annual screening, and kidneys can easily be checked with the lab test. And then incontinence, if you do have incontinence, some things that you can do for yourself are bladder training, and that's basically, making yourself hold it for an hour and kind of extending that period of time after a while, and trying to go longer and longer with each in between the bathroom trips. Maintaining a healthy weight is important, quitting smoking. There's Kegel exercises to help improve the strength of the pelvic floor, and avoiding bladder irritants, especially if you're prone to incontinence. And those are caffeine, acidic foods, alcohol, and also carbonated beverages. And we got quite a bit of questions around this topic. So the first question was, what percentage of men develop prostate issues? Again, I had to, it's not my specialty, but I researched a little bit, and it is quite common. So by age 60, about 50% of men will have what we call BPH, or benign prostatic hyperplasia, and that's basically where the prostate enlarges. And by age 85, it's about 90%. This is bothersome because it basically blocks off your urinary tract. So that's why it's hard to empty your bladder. And some people have to go to the bathroom like 10 times a night, which is not fun. So depending on how bothersome it is, there are procedures that can help with this condition. And then 1 in 8 men will be diagnosed with prostate cancer in their lifetime. However, the cancer, like how aggressive it is, varies widely. So some people are diagnosed with it, but they actually live so long they end up like succumbing to something else. So it's out there, but again, it's, it varies in how bad it is. And then 6 out of 10 people who are diagnosed with prostate cancer are over 65. The next question was, what remedies are available for a prolapsed uterus? So there are self-care measures, things like Kegel exercises, weight management, because losing weight can help with it as well, and then preventing constipation. Pessaries, which is this device that I have a picture of here, and that is available from your doctor and typically requires a fitting. And then there's also surgeries that are available if it's there's different types of procedures. So it depends on what the issue is, and they can try to figure out what the best procedure would be in that case. Are there improvements in helping with incontinence? And actually the next question about Botox and incontinence was super interesting because I hadn't heard that Botox is a new thing that we're using for incontinence. So for the first question, again, bladder training, Kegel exercises, avoiding the irritants, and preventing constipation. And I also wanted to put a plug for trying to avoid medications that are marketed for incontinence, or at least like being very closely monitored if you do take those medications, because many of them are actually not recommended for older adults because they slow down the urinary tract, but they also slow down everything else. So you get constipation, you can get dry mouth, and you can even get delirium or confusion from them. So if your doctor puts you on that, I would have a discussion and kind of keep an eye out for those things, those side effects. And then Botox, very cool. I had to Google this. But apparently Botox has been shown as an effective treatment for overactive bladder and urge incontinence, but unfortunately it's not a first-line therapy, and I think probably part of that has to do with like insurance and payment. So your provider might have you try some of these other things that I mentioned first before going on to Botox. But yeah, it seemed like it works really great for some things, for some incontinence conditions. And then sexual changes. So there are things that happen to our bodies, our whole bodies. So mostly the sexual changes do happen due to age-related hormonal changes in our bodies. So for women, there is a thinning vaginal wall, there is a decrease in the level of lubrication, the labia atrophies, the vagina shortens, the cervix may descend, and intercourse may become painful. For male anatomy, there's a decreased ejaculation, decreased stimulation, and weaker erection. The sexual identity and need for intimacy remains, of course. There are fewer and weaker orgasms. Changes can lead to a negative self-image, which is unfortunate. And people are also very reluctant to discuss sexual health with their healthcare provider. So if you want to discuss that, I would really encourage you to. There's nothing that they haven't heard, I can guarantee you. So don't be shy, and this is a very important part of our lives. So, if you are still sexually active, especially also STIs, sexually transmitted infections, good to get checked if you're still sexually active in that way. But yeah, good to discuss also. Skin and hair, I got some questions about this. So there is a thinning of the skin and loss of the elastic tissue underneath the skin, and that's why there's more skin tears and bruising. And then there's also a loss of the fat that's kind of like under our skin, and a little bit more dryness and itching that can happen because there's a decrease in production of natural oils. I think also staying really hydrated will help with that a little bit. There are benign lesions and tumors that can happen. The picture I have up here is called seborrheic keratoses. They are benign, but if you have a mole that you're concerned about, obviously talk to someone. Melanoma is no good, and easily recognized, which is nice. Some medications that can cause changes in the skin are blood thinners, steroids, antibiotics, and antidepressants. I think steroids are the ones that are the biggest offenders typically. If someone's on prednisone for a long time, they have very thin, kind of papery skin, and we have to, if they ever come to the hospital, we have to be super, super gentle with them. And then hair loss is common in aging due to hormonal changes, menopause, and androgenic alopecia, which is pattern baldness that can happen. Some musculoskeletal things that can happen, so the loss of muscle and muscle mass and strength, also known as sarcopenia. This is accelerated by weight loss, protein deficiency, and inactivity, so that's why increasing your protein intake is helpful. Due to this, you can have an increase in falls and disability, and also increased risk for assistive devices. Again, I want to plug, if you need some help and you use an assistive device, please don't be shy about it. I know all of my grandparents never wanted to use their assistive devices, and they had so many falls, and I just think part of it too is that ageism, kind of social expectations, and I think if you need a cane or a walker, please just use it, because otherwise, we don't want to see the falls, because working in a trauma hospital, we see so much of that, and just use it if you need it. So there is an increased, basically your muscles kind of get replaced by fat, which isn't great, and that's why it's really good to keep exercising, and doing some weight training, because that'll keep your muscle mass stronger. There's also a risk of the osteoporosis, so increased risk of fractures. And someone asked about the hunch, and that's basically what I have a picture here of. And that happens because osteoporosis and fractures in the vertebrae happen, and over time, basically, the person kind of becomes hunched over. There is also a decline in ligament and tendon strength, so there's more joint instability and less ability to withstand mechanical stress. So you get arthritis, osteoarthritis, and decrease in range of motion as well. So yoga is a big one, or at least like stretching and keeping your joints lubricated is a really good idea to do on a daily basis. So just wanted to talk a little bit about arthritis, because I felt like there was some questions about that. So there's different kinds of arthritis. There's osteoarthritis, which is basically the wear and tear that I just talked about. It happens to everyone. It's kind of, unfortunately, a natural part of aging. Rheumatoid arthritis is not natural part of aging. It's actually an autoimmune disease where the body's own immune system attacks the joints, and it can actually cause deformity, pain, and swelling. So if your joints, especially like in your hands, are very deformed, or sometimes they feel very red or inflamed or swollen, I would have your doctor, talk to your doctor, and you might need to go to a rheumatologist, because it could be this condition, and there's very specific medications for this type of condition to kind of decrease those attacks of rheumatoid arthritis. There's also psoriatic arthritis, which is associated with psoriasis, which is like a skin condition. It can cause pain and swelling also. And then there's gout, which apparently is very painful. It's caused by some of the best things that we consume, such as certain cheeses, red wine. I think pork causes it. But it's basically these little crystals get trapped in the joints, and typically happens in the big toe, like this picture here. And it's very, very painful. So what can you do for your joints and muscles and bones? So for calcium, all adults should get at least 1,000 milligrams per day. Women over 51 and men over 71 should aim for about 1,200 milligrams per day. And then things that are high in calcium are dairy, broccoli, kale, salmon, and tofu. And I would talk to your doctor about calcium supplements, because there are different kinds of calcium supplements, and they could probably recommend what's best for you. And in conjunction with calcium, you want to take vitamin D, because they work together. So adults up to 70, it's recommended that you take 600 IU international units per day, and adults over 70, it's recommended 800 international units per day. Things like tuna, trout, salmon, eggs, fortified milk, and supplements all have vitamin D. Also, you may know that sunlight exposure helps us with vitamin D. However, after 70, our skin is less effective in synthesizing vitamin D within our bodies, so we might need the supplementation at that point. And folks with a darker skin tone will also need more sun exposure due to decreased absorption of UV light because of the melanin content in their skin. For your bones and your joints, weight-bearing exercises are really important. So walking, jogging, things like tennis or pickleball, if that's what you're into. And weight training. So walking is really good, but it doesn't actually help kind of build your muscles, especially in your upper body. So if you can incorporate some weights, or even use like a water bottle if you don't have weights at home, just something to kind of keep your muscle mass up. And then again, smoking tobacco and drinking too much alcohol can decrease bone mass and increase the risk of fractures. So if you're concerned about that, cut down on those things. So some questions about around this topic. What is the likely timeline or process in losing height as I age due to osteoporosis? So it's a very specific question, and it would depend on, your particular health status, and it's very individualized. But basically it would depend on nutrition, your bone health, which is why it's really important to get your bone density tests when your doctor or provider is recommending those. Your activity level, like how much of that weight-bearing exercise are you doing, and then also your age, sex, and weight. And you can also keep track of your height if you're concerned and talk to your primary care provider. And then will I get hunched over? And again, ways to prevent kyphosis or the hunch is good posture, strengthening exercises, flexibility exercises, bone health monitoring, and also avoiding prolonged sitting. So yeah, some things you can do to prevent it. So the endocrine system, this is all the different kind of hormone regulatory organs that we have in our bodies. The main one of the big ones, I would say, is the pancreas. That one is responsible for insulin production, so it regulates your insulin and blood sugar levels in your blood. So with age, insulin production unfortunately does go down, and insulin resistance goes up. So again, what is recommended for that is to keep a healthy weight and to eat healthy and continue to exercise. The thyroid may develop nodules or atrophy, and there could be some abnormal thyroid function tests. Your primary care doctor or provider will typically check your thyroid levels, and if they're too low, they might prescribe a medication to help with that. Really important to take that medication. And then testosterone levels will gradually decrease in men. And then the picture I just wanted to point out just for general awareness, because a lot of times, we have some of these symptoms and we don't know why we're having them. So hyperglycemia could be a sign of diabetes. So the signs for that condition is polyphagia, which means you're very hungry all the time, and that's because your body is not able to process the sugars that you're actually eating because of the lack of insulin. So you're very hungry, you're peeing a lot because you're actually just peeing out all that extra glucose, so your urine, unfortunately, is very sweet, which is gross. But not good, right? You're very thirsty also because your blood sugar is so high. You might have dry skin, your vision might get blurry, and you might have delayed wound healing. So if you're noticing like you're having, all these things and you got like a skin tear or, or a cut and it's just not healing, you might want to get your blood sugar checked. And then hypoglycemia. And this typically happens if you do take medications for diabetes, and most of the people that do take those medications are aware of these things. But maybe if your friend all of a sudden is having some of these issues, they might be. Hypoglycemia means low blood sugar. So their heart rate might be very fast. That's what tachycardia is. They may be very irritable and restless or anxious. They might not make any sense. I worked with a nurse who was a type 1 diabetic, and we were working night shift, and my charge nurse from our other unit calls me and he says, "Oh, Danny's not acting right. I don't know what's going on." And we were all freaking out, and then someone overheard and said, "Oh, he's diabetic." And he was totally not making sense. He had given himself some insulin and got sidetracked into doing something, and his sugar just plummeted. So by the time I ran down there, he was drinking a juice and he was making sense, luckily, but it was a little scary. So, and that's why a lot of times we mistake hypoglycemia for a stroke also. So if we think someone's having a stroke, we'll often check their blood sugar because the symptoms are very similar. Alrighty, so I think that concludes my portion. So Rebecca will talk about some atypical presentations of common conditions.
Just to advance it, are you just so I know?
Yeah, just click there. I think
Perfect.
so. Yeah.
Perfect. Thank you for having us. We're really happy to be here to share with you guys today. My name's Rebecca, and I also work at UC Davis. I've been a nurse for about 10 years, and I work on the orthopedic floor. So again, thank you so much. So I wanted to share with you regarding the atypical presentations that can be with our age-related changes, as we, in the older adult population. So there are certain conditions that can manifest differently in older adults, and just recognizing these things will ensure that, as Olga was throughout her presentation, she was just saying, if you are unsure, it's good to go get it checked out. It's just good to pay attention to anything that you're finding that is different and that you're noticing, because awareness will help improve your outcome, and vigilance is important. Just to not ignore things is what we would encourage you to do. Wrong one. A little bit. There we go. Got it. All right. I'm on track. With diabetes, as in an older adult, you can have some of the same symptoms that a younger adult would have. So in a younger adult, we would maybe see thirst, weight loss, blurred vision, excessive urination or hunger, fatigue and weakness, nausea and vomiting. So an older adult might have those things, but then there could be other symptoms as well, such as anorexia. So instead of that hunger, it could go the opposite direction, and you would have a loss of appetite. Also, there could be incontinence, falls, cognitive and behavioral changes, blood pressure and postural low blood pressure, urinary tract infection, and frequent yeast infections. So again, we want to watch for those things in an older adult, and just be aware that some of the same condition, diabetes, might show up in different ways with an older adult. Now, when Olga was talking about the respiratory system, she brought up pneumonia, and in a younger adult, they might display fever, chills, cough, a productive cough, and fatigue or chest pain. But with an older adult, you could just have generalized functional decline. You could have an altered mental status or delirium. Delirium is just an acute change with your cognition that as she mentioned, it can be brought about by an infection that you're dealing with. You might not have a cough because you might be dry in your respiratory system. And you might have only a slight elevated temperature, whereas maybe a younger adult would have a true fever, or you might have a low temperature with a pneumonia, and also you could have shortness of breath if you're dealing with pneumonia. Oops. Go. Okay, and then dehydration. So if you haven't experienced it, I feel like I'm already starting to experience this, but just your thirst mechanism may not be what it once was. So when we're younger, that thirst kicks in, it's just natural, and we know to hydrate. But as we get older, sometimes that's not the case. And if our thirst mechanism isn't telling us to drink, and we don't, we can easily become dehydrated, that can also cause confusion. So in our presentation, we have a website here, elderlyguides.com. This is a really helpful website where you can actually plug in some of your personal information, like your height and weight, I assume, and
Credit card.
no, not that, but just your statistics. Yes, and there's a free calculator that will show you about, for you specifically, what would be recommended fluid intake. But generally, daily fluid intake would be 6 to 8 cups per day. And individual requirements, as I mentioned, would be based on your weight, age, sex, or medical conditions. But that calculator is a helpful tool. Now, urinary tract infections are common. With that, especially in women that are aging, we can sometimes have a weakening of the pelvic floor muscles, and with that, we have more urinary retention and then more infection risk there. Also, the pH of the vagina can change, and that can affect the urethral structures that are nearby and also have an increased risk for these infections. But a younger adult would feel pain, burning, frequency, suprapubic pain, and maybe flank pain. But in an older adult, we can have those same symptoms, but also accompanied by incontinence, confusion and delirium, nocturia, which is urination at night, that would be something that we wouldn't normally be having, and anorexia, just that loss of appetite. Now, tuberculosis, that can affect different parts of our body. But most commonly, it could be found in the lungs. And the county, very closely assists if someone is diagnosed with tuberculosis to get on a medication regimen that will help its spread. But when we see it, like in a younger adult, they might have fever, night sweats, or hemoptysis, which is coughing up of blood. And in an older adult, it might manifest with confusion or nonspecific pain and dizziness. We can see just from the photo there, it can be in a latent form, it can be cavitary or miliary, I think it's, yes, miliary tuberculosis. So there's different forms, and if that's of a concern, that's a really important one to get checked out right away because of its contagious nature. And then peritonitis. Peritonitis is an inflammation of the lining of the abdominal cavity. And with that, there are common causes for the peritonitis. This image here, I'm not sure. Oh yeah, I think you guys can see it. It's a pretty good diagram there. But common causes of peritonitis might be a constricted hernia. So if you have a hernia, these are things that you can't really, there wouldn't be anything you caused to have that happen per se, but if you had a hernia that was constricted, if you had a perforated duodenal or gastric ulcer, or a perforated appendix, pancreatitis, or cholecystitis. So inflammation of the pancreas, inflammation of the gallbladder, or a perforated appendix. These things can cause peritonitis. But in a younger adult, they may have the abdominal rigidity, have pain, poor appetite, nausea or vomiting, and with an older adult, confusion and fatigue. So these are some atypical presentations of these illnesses and conditions, and it's important to know that you just want to be vigilant, as I was sharing. And because I work in orthopedics, I will put a little plug in. Olga was talking about the musculoskeletal system, and I do want to say, in working with a lot of patients who fall and break hips and knees, definitely use your ambulatory devices. Don't be afraid to walk with it. Use your cane if you need it. Use your walker. I say it to myself. I say it to my own parents, because you don't want to let anything that you can help, you don't want to allow yourself to fall. When you fall and you're having to recover, it's a lot more than you will need help with all things versus, you just, you need help to walk about. Well, then you're going to need help to get dressed, use the bathroom, a lot of other things that you wish you could just do independently. So definitely use your ambulatory devices and stay safe as you get around and as you move. Thank you.
Hello, everyone. Thank you, first of all. I'm very glad to be here. My name is Sunita, and I'm a registered nurse. I work at UC Davis. I've been a nurse for 16 years, and I work on oncology unit. So once again, very, very thank you for having us over here. My presentation is going to be on sensory changes. So as you all know, as we age, some of the sensory changes includes our skin, our tongue, taste changes, our vision changes, and our hearing changes, and our smell. So I'll be going in detail with all these changes that will occur. Okay, so 2.6 million older adults have visual impairment. And at least 50% of those over 75 years old have a hearing impairment. At least 50% of people over 80 years old have an impairment to their sense of smell. Aging impacts nerve endings involved in pain, pressure, temperature, vibration, and body position. And taste impairment in older adults is rare. It's less than 2%. However, some treatment and medication can alter sense. So impacts of sensory changes could impact interaction with others and the environment, and decrease in ability to communicate and increase risk of social isolation. It can lead to functional decline and loss of independence. Some safety issues that we have to keep in mind is that if you're unable to smell smoke or gas, inability to see hazards, issues with driving and hearing warnings or alarms, increased risk of falls, risk of ingesting spoiled food, and there's also increased risk of delirium. So delirium is a serious change in mental abilities that results in confused thinking and a lack of awareness of one's surroundings. It usually comes on quickly within hours or a few days. Some changes in our vision, it's a difficulty to adapt to light and dark. So presbyopia is something that when we are not able to see close, that condition is called presbyopia. And sometimes our visionary change can reduce our vision to have an upward gaze, and then visual field and pupil size. So sometimes we can also feel dryness. Another common vision condition in older adults is cataracts. Cataract is a clouding of the lens of the eye, which is typically clear. So the risk of developing cataracts increases with age. About 20% of people aged 65 to 74 have cataracts, and this increases to 50% for those aged 75 and older. So it's a very common by age 80, more than half of all Americans either have a cataract or have had cataract surgery. Change is usually slow and gradual, so initially better lighting and glasses can be helpful, but if vision is very impaired, a surgery may be required at that point. So the good thing about that, cataract surgery is very generally a safe procedure, and it's very effective also. Another common vision condition is macular degeneration. So it is the retina which gets there's a deterioration of the central part of the retina, which results in central vision loss. And glaucoma, this condition where the eye's optic nerve is damaged with or without increased intraocular pressure. So there are two different types of glaucoma. One is open angle glaucoma and the other one is acute angle closure glaucoma. The open angle glaucoma usually occurs in people greater than 50. There's a loss of peripheral vision, especially at night, and early detection and treatment can slow the progression. There's no cure for that. But the other one, the acute angle closure glaucoma, it's an eye emergency condition. It's a sudden increase of pressure in the eye. So some of the symptoms that causes are headaches, nausea, eye pain, and blurry vision. So happens between age 55 and 65, and this requires immediate treatment. Retinopathy. So any damage to the retina causing vision impairment, some of the causes are diabetes, hypertension, or other vascular issues. So retina is a layer of cells at the back of our eyeball, and that converts light into our nerve signals. And when those nerve signals get damaged, then it's very important that we have to get that rectified. So other common vision conditions are the temporal arthritis. It's an autoimmune disease, and it's the inflammation of the arteries in the head near the temples. Some of the symptoms: double vision, sudden or permanent loss of vision in one eye, severe headache, especially at the temples, jaw pain while chewing, and fever and fatigue. Again, the retinal detachment is an eye emergency situation. So the retina pulls away from its usual position and causing vision loss. Some of the symptoms are flashes, floaters, and partial blocking of visual field. So what can we do? We can get our regular eye exams, eat a healthy diet, like eat plenty of green leafy vegetables and colorful berries and fruits. These contains vitamins and minerals important to eye health. Some evidence suggests that gum disease may be linked to optic nerve damage in glaucoma, so regular brushing and flossing is very important. And exercise, control high blood pressure and diabetes, protect your eyes from injury and ultraviolet rays, and good oral hygiene. And now moving on to our hearing, some of the changes that can occur is that our eardrum can be thickness, presbycusis, it's a loss of high frequency hearing, that is a damage to the inner ear, and decrease in ability to process sounds. If you're greater than 50, there's more earwax, and hearing loss is more frequent in older men than women. So, look, there's a nice illustration over here. What four-letter word do folks with hearing loss use most? What? It's funny. So conductive hearing loss. This condition, sound can't reach your inner ear. It involves outer or middle ear. So some of the causes are earwax impaction, foreign body, ruptured eardrum, otitis media is a ear infection, osteosclerosis, abnormal bone growth in middle ear. And some due to sensory neural hearing loss is damage to the inner ear, and because of the hair cells of the cochlea, auditory nerve. Some causes are infection, tumors, noise, ototoxic drugs, Meniere's disease, cardiovascular conditions, and genetics. Central auditory processing disorder. This is inability to process sound due to stroke or Alzheimer's disease. Tinnitus is a fluctuating ringing sound. Meniere's disease is a fluctuating hearing loss, dizziness, vertigo, tinnitus. Meniere's disease is a severe vertigo, and tinnitus is possibly due to fluid in the inner ear. Women are at a higher risk for this. So what can we do? How can we prevent hearing loss? Some of the things we can do is avoid loud noises and wear hearing protections, and then check medication side effects, give up nicotine, take headphone breaks, and then have your hair checked. Taste changes. So as we old, our taste buds, they become less, they are fewer taste buds as we old, so less saliva, that leads to dry mouth, which is called xerostomia. And some of the conditions that can contribute to dry mouth is anti-Parkinson's, medications that these are actually the medications that can cause dry mouth. This is anti-Parkinson's, anticonvulsants, antidepressants, and antihistamines, and lipid-lowering agents, and opioids, oral conditions, and if you have dentures, or even decreased sense of smell can also lead to taste changes. So examples for medications are antibiotics, allergy medications, chemotherapy, and antidepressants, and tobacco use can also cause taste changes. Moving on to our smell, so it's a hyposmia. There are several conditions with our smell. One is the hyposmia. That means it's a reduced sense of smell. It could cause because of allergies, nasal polyps, or upper respiratory infections, and head trauma. Anosmia is absence of sense of smell, and parosmia is abnormal distortion of the sense of smell, and phantosmia is perception of smell that's not really there. So loss of smell has been linked to Alzheimer's, dementia, and Parkinson's disease. So it can speech, the next part of our sense is a speech impairment. It can be a part of normal aging due to weakened vocal cords and voice box muscles. Significant impact to the health and well-being of older adults. So majority is related to stroke or transient ischemic attack. It may be a result of medical procedures or surgeries, could be due to advanced dementia or Parkinson's disease. There is Healthy Aging Clinic, and this clinic is designed to provide comprehensive care for older adults and their family caregivers. So they are specialized in, they have specialty medicines in this clinic, that is geriatric medicine, cognitive neurology, dementia care program, dietary nutrition, mobility care, patient navigation care, case management, pharmacy, social work, family caregiving institute, and patients can be referred from the hospital or from your patient primary care physician. So this caregiving institute was founded in 2017 at the Betty Irene Moore School of Nursing. It is a place that has led research in family caregiving, and it provided education to the community and to the UC Davis workforce. It mainly specializes in supporting the family caregivers in their work, and most recently, they are providing consultations to family in the Healthy Aging Clinic. So if you have anyone, or if you want to get checked up, this is a very good place to go for especially for older adults. So they also offer classes on what is called matter of balance. So if you know anyone, or if you think you are at a risk for a fall, or if you have fallen in the past, or if you have some restricted activities because of falling concerns, or anyone who can walk independently may use cane walker when needed. This class, we can attend these classes, and this class is a multi-session outpatient program to enhance balance. It manages falls and boost activity levels. Participants learn to view fall as controllable. They set goals to increase activity, improve balance, flexibility and strength, and they assess home environment to reduce falls risk. So this program is 2 hours per session, once a week for 8 weeks. So here we have other helpful resources over here. So in Sacramento, we have county aging resources. This is a collaborative project between Sac State University Gerontology Department and the Sacramento County Adult and Aging Commission. So if you're interested or if you would like to know more about any of the disease conditions, or if you want any resources, the resources are listed over here, and we can share this information to you also later. Again, some more aging resources exchange information over here that has been taken, like in 2024, what are the resources that's available, and there's per year, there's information if you're looking for anything in particular. So moving on to some questions. So one of the questions is my difficulty in getting up off the floor an indication of how soon I will die? No. Frequent falling is a concern and can be caused by a serious condition. Let your healthcare provider know if you have fallen in the last 6 to 12 months or have frequent falls. So exercise, physical therapy, and programs such as Matter of Balance can help prevent falls, anxiety about falling, and teach you how to get back up. Another question, will I need a mammogram my entire life? Does breast cancer risk increase with age? Women over 55 can switch to getting mammogram every other year. However, you can continue annual screening if you prefer. Unfortunately, the older the person is, the higher the risk of developing breast cancer. Most breast cancer cases are diagnosed in women over 50. The median age for breast cancer in women is 63 and for men is 69. What determines if an older adult can withstand surgery? So there are many factors that can determine if a surgery is safe. So first is overall health, the general health of the patient, including the presence of any chronic conditions like heart disease, diabetes, or respiratory issues. They all play a significant role. Frailty refers to a state of decreased physiological reserve and increased vulnerability to stressors. Frail individuals are at high risk of complications. Nutritional status, good nutrition is essential for recovery. Malnutrition can increase the risk of complications and slow down the healing process. Cognitive function, cognitive health is important as conditions like dementia can affect recovery and the ability to follow post-operative care instructions. And then type depends also on type of surgery and what are the anesthesia risks and what support system you have after getting a major surgery. How do we separate aging decline, like decreased energy, from something that might be an important symptom of illness? So it's really important to keep track of your new or bothersome symptoms, because if something new, did it come up suddenly or is it progressive? Are there any symptoms associated with it? What happened? Just keeping track of all those things. What happened just before experiencing these symptoms? And keeping notes of it, it's also another valuable thing to do. So it can be helpful while you're taking those notes and talking to your healthcare provider. So we may have to ask ourselves, like, if my friend or loved one told me if they were experiencing this, how would I react to that, and would I be worried about them? Okay, thank you. Thank you. Any questions?
Green?
Well, yeah. My friend has a few hundred too much for Medi-Cal, but has arterial, whatever it is. She's losing her mind. Okay. So, can you say something about that? A few $100s too much for Medi-Cal, but she needs it.
What is the question? Sorry.
What can she do to try to get Medi-Cal anyway? If her medical expenses go up or something?
Yeah, sorry, I don't think I... Yeah, I'm sorry. Does anyone? Sorry.
You didn't touch on peripheral artery disease. It's not related to diabetes, and I was just wondering if you had any suggestions as to what might be helpful for that.
Sorry. Yeah, there definitely were a few things I haven't touched on just because this topic is so vast. You guys would be here forever. But peripheral arterial disease, preventative things are kind of what we talked about, like healthy, supports, compression socks, healthy diet, not smoking. Smoking is a very, very big risk because it damages blood vessels. Healthy diet as far as like low cholesterol. And then typically if you notice, I'm trying to, you guys are really quizzing me on my physiology, but peripheral arterial disease, I seem to remember that some of the symptoms are just very kind of red, hot legs. So if you do have, and swelling, thank you. You're cardiac, right? Yeah. So yeah, if you do have those, especially in both of your legs, in one leg it's another condition, could be a blood clot, which is also very concerning. But I would talk to your healthcare provider. There are some things they can do, but the best thing is prevention and kind of like trying to slow down that process.
It seems, this is, I guess, more of a statement, but it seems like there's a lot of things that manifest in older adults that look like common symptoms, like loss of appetite or maybe some confusion, stuff like that, but could be an indicator for other diseases, and the kind of thing that would be easily blown off either by the individual, like, oh, I don't have a fever, I just feel tired all the time. So I guess that's, for me, the take-home message is to try to be an advocate for myself with my healthcare provider, number one, but also the importance of keeping track of some of those things, like this just happened or it's been going on for a long time. It seems like that would be an important thing for older adults to do, because everything shows up as, not everything, but many of those things showed up as, well, you could be confused, you could be tired, you could maybe lose your appetite, so really general stuff for specific diseases.
Yes, very good point. Very vague kind of symptoms, and totally agree with all of that sentiment. And I think a lot of times too, we find ways to kind of manage those, or like, justify them in our brains. So that's why I put that question there of like, if my friend told me that they were having this, would I be worried about them? So yeah, very good point.
At the very end of Sunita and also I think Rebecca and you, there was some resource pages. I wonder, can those be sent to me as a PDF that I can share with folks? And I know a couple of them had a lot of QR scan codes, so thanks.
Yeah, I'll make a one-pager and send it to you.
What can you tell me about Botox injections for incontinence? Botox in the bladder.
So I did cover that. I'm not sure if you missed it. It is an effective treatment, but it's not a first-line treatment. So I would discuss that with your healthcare provider because it is available. But I think depending on your particular condition or the particular condition and or insurance, et cetera. But it is considered a treatment, it's a newer treatment, and supposed to be very effective. Any other questions? Oh. Okay, sounds good. All right, last question.
Is there a recommended age when you stop colonoscopies?
I don't know off the top of my head, I'm sorry. I did consider making a slide on like all the recommended kind of screenings, but I don't know that off the top of my head. I can get back to Celia about that, sorry. But I'm sure your doctor can tell you. Okay, thank you so much, everyone.
I really want to thank Olga for coming out and for Rebecca and Sunita to add their expertise in areas that affect folks as we age. It's not just geriatrics, but we get cancer, we break things, we're in the hospital. It was so appropriate for Olga to have somebody with cancer specialty and with orthopedic specialty to join us. Thank you very, very much for coming.